Or what's going on here? Okay, she has a VTAC. I'm younger one works for the VTAC, so I'm gonna give her a bolus of this in an IV. All right, let's see what happens.
Ooh, I feel much better.
All right.
Hi, Miss Latani. How are you feeling?
Hi. I'm feeling better, but I'm a little lightheaded.
Lightheaded? Yes, I can see on the monitor here your blood pressure is very low. But don't worry, dopamine will bring that right back up.
This is another dose of amiodarone that you must take. It's a 200 milligram tablet, PO. That which doctor has prescribed for you for today. So.
I just had a question. I think you gave this to me earlier.
Oh yeah, we gave you a bolus.
How does that work?
Well, because you are going into tachycardia, we needed you to have an immediate drug effect. So we gave you a bolus of that. But how it works is that it is a very effective anti-dysarrhythmic, and it blocks your potassium channel in your heart and slows down your heart and also make your heartbeat regular.
What are some adverse effects when I'm taking this drug?
Yeah, there are many side effects. Well, first of all, it is a very fast-soluble drug, and it stays in your system.
Got lots of those.
Oh yeah. It stays in your system for a very long time.
Yeah.
It has a half-life of average 50 days in your system. So the adverse effects are mainly toxicity in your lung, heart, and liver. Causes all kinds of skin reactions. It could also cause AV block, and in severe cases, it could cause pulmonary fibrosis. So, if you have any symptoms of side effects, you should notify the physician.
I will.
Do you have any other questions?
Yes, and what are some drug interactions?
Actually, there are so many drugs that it interacts with because it is metabolized in the liver.
Okay.
Well, it interacts with total 709 drugs.
That's a lot.
Well, major interaction with 271 drugs and moderate interaction with 348 drugs. Are you currently taking a beta blocker?
I am, yes.
It interacts with a beta blocker, so you better go ahead and check with your doctor.
Okay.
All right.
I will. Thank you.
You're welcome.
How did the drug work to increase my blood pressure?
Well, you're welcome for saving your life. I gotta give credit to Yohan on that one too, though. So after your VTAC episode, your heart was pumping very ineffectively, and so your blood pressure was very low. So what we did was we gave you dopamine. Dopamine we can only give through an IV. We give it 2 to 5 micrograms per kilogram per minute. Given that you are slightly obese, we had to give you a lot of dopamine. But it worked. We got your blood pressure up. And we did that because dopamine works on the beta-1 receptors of your heart. And it increases your heart rate, and it increases contractility, so your heart pumps stronger, more effectively.
Okay.
If we give too much of it, it can cause tachycardia, dysrhythmias, like VTAC, which is what you already went through. We don't want to do that. So we need to be very careful about dosing. Dopamine actually, if you give it with other inotropic agents, like epinephrine, it can cause VTAC again, and we don't want that. Also, if you're already taking an MAO inhibitor, it can cause severe hypertension.
Oh my god, I don't feel good!
Oh my, yes, Miss Otani.
Why am I feeling this?
I'm so sorry, I forgot to tell you. Nausea and vomiting is also a very common side effect.
Hi, Miss Lee.
Hi.
So you're here for heart failure.
I am.
So your doctor has prescribed the digoxin, so I'm going to explain how this drug works.
Okay.
Digoxin is a cardiac glycoside that can help a weakened heart function properly. It increases the strength of the heart muscle and helps to maintain a normal heart rhythm and helps to remove excess water from the body. So it can help relieve symptoms of heart failure by inhibiting sodium-potassium ATPase, which increases intercellular calcium concentration increase the ability of the heart to pump enough blood through the body.
So how should I be taking this medication?
So it is best to take on empty stomach at least 1 hour before or 2 hours after meals. So take only the prescribed dose because it has a narrow therapeutic range, which can lead to toxicity.
What are some things that I need to watch out for?
Do not start taking your digoxin without your doctor's advice, even if you feel better. And check your heart rate and blood pressure regularly while you are taking it. Also, watch your diet because a diet high in brain fiber may interfere with the digoxin absorption.
Okay, and what are some side effects?
Okay, side effects include anorexia, nausea, vomiting, diarrhea, maybe confusion, delirium, or vision changes. Also avoid taking digoxin with other drugs such as beta blocker or ACE inhibitor because they can interact with digoxin. Do you have any other questions?
No, I don't think so.
So, Mr. Lewis, how are you feeling today?
Oh my gosh, I can't breathe. I'm so tired all the time. I got this terrible cough. I've got no appetite, but I'm gaining like 3 pounds a day.
That's strange. Let me check your heartbeat. You have an irregular heartbeat, so that could be heart failure.
Heart failure? But I came to the ER just a couple weeks ago. They said I had heart failure. They gave me some drug, carvedilol or something like that. They said it was going to help my heart failure. I felt better, so I stopped taking it.
So you're not supposed to stop taking carvedilol even if you feel better, because that might actually cause adverse effects. Did you hear anything about how the drug works?
No.
Well, let me tell you now. Carvedilol is a type of non-selective beta blocker, but it's unique because it also works to block the alpha-1 receptor. And that's going to help vasodilate your arteries and veins, and that's going to decrease your heart's workload. And your heart's like pumping, and it's getting tired. But the drug also blocks the beta-1 and beta-2 receptors, and that will decrease your heart rate as well as the force of the contraction.
Wait a second. I thought that with heart failure, you want the heart to wake up and pump more. But you're saying you want to decrease my heart rate. Is that what I'm hearing?
That's what most people thought, but evidence shows that carvedilol actually helps your heart's pumping efficiency. It also enhances exercise tolerance and slows progression of your heart failure. So think of it kind of as a chill pill for your heart. The important thing is you don't want to discontinue the medication suddenly because you might have a rebound effect.
Since I started taking the carvedilol, I've been having a little trouble with the ladies, if you know what I mean. Specifically my lady. And
Okay.
is that common? And what other kind of side effects should I be worried
Yeah,
about?
unfortunately, sexual dysfunction is a common side effect, but you want to keep taking the drug because you don't want to make your wife sad when you actually are hospitalized. But other side effects that are common are dizziness. You might feel lightheaded, but those are less serious. The ones you really want to watch out for are allergic reactions, and also if you feel bradycardia, hypotension, chest pain, shortness of breath. All those are serious side effects that you need to notify the doctor ASAP.
There's just so much to be aware of with this drug. Is there anything else I need to be worried about?
Actually, yes. Carvedilol does react with some drugs, like other heart medications. If you're taking those medications, that might actually slow down your heart too much and you might go into cardiac arrest. Also with MAOIs and antidepressants, that can increase your hypotensive effects. And lastly, if you're taking NSAIDs like aspirin or ibuprofen, that can decrease the efficacy of the drugs. So there's all these drugs that come into play. You need to let your doctor know if you're taking any of these, okay?
Well, thank you, nurse. I really appreciate your time.
No
I'll be sure
problem.
not to stop taking my meds this
Yes. And you know there's many other ways to please a lady.
time. Oh.
Knock, knock.
Come in.
Mr. Lee, how are you doing?
Well, I came into an urgent care because my heart was racing, and then I couldn't breathe. And then I was getting dizzy and I fainted a couple times. Look, how old are you?
Much too young for you.
Well, I just turned 73 years old. But ever since I turned 60, everything's just not the same anymore. I used to be a pop star, but nobody likes me anymore. What's wrong with me?
Well, looking at your ECG, it looks like your heart's not beating regularly. And we've put you on IV diltiazem. So it's a calcium channel blocker, and all that means is that it keeps the calcium from going into the cells. So it targets your arterioles and your heart, and it causes the vessels of your body and your heart to relax and open up. That way your blood pressure drops and blood flow to your heart increases. This should help to make your heart beat the way that it's supposed to. So diltiazem is normally prescribed for chronic stable angina, hypertension, and in your case, dysrhythmia.
Well, listen, I don't understand this single thing that you just told me. Well, will this drug help me?
Yes, and if for some reason it doesn't, we'll put you on verapamil, which is in the same calcium channel blocker family. I do want you to know that there are some common side effects. You could experience some dizziness, flushing, headaches, swelling in your ankle and your feet, and in elderly folks, sometimes eczematous rash.
Well, I was already having dizziness before taking this drug, and you're telling me this drug will cause dizziness?
It's possible.
What? And a rash? It's supposed to help me. What other surprises do you have?
Well, if you're on digoxin, it'll actually magnify the suppression of the AV node, and it might cause your heart to beat too slowly. And then if you're also on beta blockers, it works similarly to calcium channel blockers in that it dials things down, so you want to be really careful if you're taking them together.
Well, my heart certainly isn't racing anymore at this age after taking this medicine.